Hey, this is Dr. Jared. Wanted to take a few minutes today and go over how to do your home equipment. Before we do that, I want to congratulate you on getting started here. I know that this is a great opportunity to have way better health, to build your immune system, to get rid of any symptoms that you might have come here with. But what we're going to go through today is the home equipment and what you should have just received. Now, the reason that we do home equipment is because home equipment, first of all, lowers the number of chiropractic treatments that it takes to get the outcome that you want, but also it's going to speed up the progress that you need. So when I say that, from a statistical perspective, on average, if you do the home equipment as prescribed, you're going to get 60% more improvement than if you're simply getting the chiropractic treatments in the clinic alone. So you're going to get results either way, but like I said, home equipment is going to really speed that up and give you the best possible outcome. So I'm going to go through several things, but first of all, as far as frequency, what you want to do for the majority of these exercises is do them twice a day for the first 3 months, once a day for about the next 4 months, and then as your treatment starts to slow down, or as your frequency might start to slow down, you'll also drop down or graduate down to more of like a 3 or 4 times per week for the majority of these exercises. If you do have any questions at any time, feel free to ask our staff or ask one of your doctors. But again, this is an easy way for you to get started. So first of all, the two things that I'm going to go through first are things that you already know how to do. The first one is the wobble chair. So just as a reminder, the reason that we do the wobble chair is the wobble chair both relaxes the muscles, so it can help with stiffness, and it's going to help pump spinal fluid into the discs, so to help the discs in your middle and lower back heal. So we will pump this up to your liking or to your specifications. You want to work your way up to 60 repetitions, all 4 different motions, forward and back, side to side, and both circles. Following that, you also have received neck traction, which again you do in the clinic here. Now, we're not expecting you to drill this into the wall like we have done at this clinic, but what you do is you put this over a door. So this comes with a block which is going to hang over any firm door, and that's going to help the neck traction stick out so that you can do the straight downward traction. And then you're going to do traction just like you do at the clinic for 1 to 3 seconds, working your way up to 60 repetitions total. Now, one thing that I get a lot of questions on, and so I want to explain, is what's with these little donuts or these little circles. So there's 3 different settings. The first setting, for those of you that are having a lot of neck pain or have a lot of arthritis, you want to push your circles or donuts all the way to the center, because that puts the softest or least amount of tension in any one spot in your neck. For those of you that are maybe in between, you're going to space this out partially and you're going to separate it a little bit. For those of you that want more of a pull right at the top, maybe you say you have migraines or you feel like you hold your stress in the upper neck, or on your x-ray it showed that there's a large amount of compression, you're going to spread it all the way to the edges and really focus on pulling with the more thin part of this bar. So again, working your way up to 60 repetitions, doing that twice a day, that's the 2 things that you know how to do. The next thing you may also know how to do, which is called the head weights. So the head weights are done in the clinic on the vibration plate, starting at 2 minutes, working your way up to 5 minutes. At home, you want to do head weights for somewhere between 5 and 10 minutes a day total. So this is one of the ones where you're not going to do this twice a day. You're going to do it once a day, 5 to 10 minutes total. A couple of the things that are important to remember about head weights: you want to have the bottom of the head weight right at your eye line. So that's going to help with putting it in the right position as far as getting your postural muscles more upright, helping to stimulate more curvature in your neck. If you've lost any percentage of the curve in your neck, if you've seen it on your x-ray, what the head weights do is they help put more curve in the spine. One study showed that when you wear head weights daily for 3 months, it will increase the total curve on average by about 30 to 35%. So again, a way to help the adjustments work more effectively. The adjustments unlock your spine. The head weights help to strengthen it, to make it change faster. So again, a better structural improvement. Most people are going to start with 2 pounds, and if you have any questions on this, ask your staff, but 2 pounds of weights in their head weight. The last main exercise here are rolls. So foam rolls. Now foam rolls are used most often when someone goes to sleep. I will say it is a little bit better to lay on a firm surface like a hard floor. You want to do these for 5 to 20 minutes a day at least. So at least 5 minutes every day. Now what you're going to do is you're going to use this small roll in the small of your back. So if you were going to arch your back, or if you look at this poster, if your back was completely arched, you want to put the small roll right where it dips in the most. For your bigger roll, this is going to go under your neck, and again, if you arch your neck, right where it dips in the most, this is where you want to put it. I will tell you, most people end up using these on their bed as they go to sleep at night. A few people as they get up in the morning. Now there's two different types of rolls. So the red rolls are the medium rolls. So this is what you should start with. You want to do these again 5 to 20 minutes a day. Once you can do 20 minutes with no discomfort or no major stretching feeling, it's time to upgrade or time to graduate to the firm rolls. Now again, why do most people do them in bed? Because one of the things I love about these is you can't do them for too long. And what I mean by that is a lot of people that are able to fall asleep on their back, they'll fall asleep on the rolls. So they might do them for 2, 3, 4, 5 hours. I've had people fall asleep on them and sleep on them all night. And again, it's just going to continue the stretch. It's going to help with repairing the ligaments and allowing your body to change as fast as possible. Now it is very important, especially with these rolls, there's a cumulative benefit. So doing them day after day is very, very important. In fact, it gets you a lot more result than if you do them sporadically. So again, this is the basic understanding of what you need to do. At your next appointment, what we will do is we will have a staff member go through an individualized exercise sheet and answer any questions that you have about your home exercises. So we strongly encourage, and I strongly encourage you to try all these things out tonight when you get home, so that if you do have any questions on your next appointment, we can give you the best service possible. Have a great day, and I look forward to seeing your progress.